Hello, I'm Nabiha Kazi Hutchins, and I'm the President and CEO of PAI. In the United States, we are marking the one-year anniversary of when our 50-year federal constitutional right to an abortion was revoked. I'm recording this video from Texas, and I share that because Jane Roe was the original plaintiff, and her name was anonymized in the 1973 Roe versus Wade ruling, which made abortion legal throughout the United States. Jane Roe hailed from Texas, and the case that made its way to the Supreme Court initiated in Texas. Now, reflecting on this year, it's been quite the roller coaster ride. For those in the U.S. who are standing for human rights, for those of us who are dedicated to healthcare access and equality and justice. There's a battle, and we see this battle between the preferences of a majority of Americans, and I say majority because more than 70% of Americans believe in the right to choose. And this battle with the will and the outsized financial resources of an anti-rights minority that is doing all that it can to extinguish our sexual and reproductive health and rights, our agency, and our autonomy. But a year since the reversal of Roe, we are still fighting. We're fighting through our advocacy and PAI's accountability work to ensure that our own U.S. government does not do harm and that we are protecting the rights of people. We're also fighting in collaboration with our work alongside sexual and reproductive health and rights advocates in more than 30 countries who are themselves fighting for their own rights and ensuring that the legal examples, the policy examples, and the funding from U.S. opposition groups do no harm. None of this is easy. And I think in this moment, we can't rest. We must continue to resist. Last year, during my remarks at the steps of the Supreme Court, I said that the world was watching. And not only did the world watch, but the opposition was emboldened. What started with the reversal of the right to an abortion has not ended with abortion. We see attacks on comprehensive sexuality education, which prevents young people from learning about their bodies and their rights. We see attacks on the LGBTQIA+ community and their fundamental human right to be who they are and love who they want to love. And we see efforts to derail access to safe and essential health care, such as emergency contraceptives and the abortion pill mifepristone. Both have been used in the US and around the world safely for decades. We also have to remember, though, that we are all putting up a formidable fight. There are elected officials, judges, activists, policymakers, NGOs, researchers, corporations, and many more who are standing arm in arm as we fight for our rights here and around the world. What is going to fuel our work is our work as a community of rights defenders and rights holders. Together, we must stay vigilant. We must stay connected and coordinated, because we know when that happens, good policies come forward and people's lives are better. We have examples of the progress that comes from the power of a community of advocates and accountability holders through our work and through the work of more than 70 of PAI partners and our shared extended network of 1,800 community-based advocates who are individually and collectively standing strong. The threats don't stop, but we won't stop fighting them either. Let's get ready for what's next. And I invite you to stand with us because we know that when we do that, we are stronger together.